All right, welcome everyone to our webinar today. Today we're going to be talking about the impacts of recreational cannabis legalization on acute poisoning and mental health in children. And this webinar is presented by the Canadian Collaborative for Childhood Cannabinoid Therapeutics. Before we begin, I'd like to acknowledge that folks are calling in from all over Canada and abroad today. And I'd like to share a land acknowledgement that was delivered by one of my colleagues, Dr. Malcolm King. On a national level, we encourage all Canadians and visitors to Canada to learn about the Indigenous peoples on the lands in which they live, work, and visit, and become engaged allies together. We as Canadians, in the spirit of truth and reconciliation, respect the self-determination of First Nation, Métis, and Inuit, and their rights and responsibilities in culture, language, and the pursuit of wellness. And I'd just like to acknowledge that I am calling in today from Winnipeg, which is Treaty 1 territory and the homeland of the Red River Métis and ancestral lands of the Anishinaabe, the Inninewak, and the Dakota Oyate people. Just a quick introduction to sort of who is hosting today's webinar. So C4T is an academic research team. We are housed at the University of Manitoba. And this group represents more than 130 youth, parents, clinicians, policymakers, and scientists from 14 different research institutes across Canada. And we'd just like to acknowledge many of our funders that make a lot of the work that we do possible, including the Canadian Institutes of Health Research, the Canadian Cancer Society, the Sick Kids Foundation, Research Manitoba, and the University of Manitoba. The mission of C4T is really to conduct and share high-quality research on cannabis used for medical purposes in children that is informed by patients, parents, healthcare practitioners, policymakers, and the scientific community. And really, C4T came together because, as we're going to talk about today, there's a lot of nuances around cannabis. And when we think about cannabis as medicines, we needed a new way to come together and generate evidence on if and when these products could be used safely and what the long-term harms and benefits might look like. And just two slides to sort of position everyone, as I figured there may be some international folks on the call today. There's lots of reasons people use cannabis. And here in Canada, there are many, many different products that are available both in a legal market and an illicit market. And everything in Canada is sold to meet good production practices. This is the medical cannabis stream, recreational stream. All of the products in Canada meet the same quality standard. And they're supposed to be, there's no limit on certain products like dried flower, but on edibles there are. And they're supposed to be around 15% from what is labeled. They have that kind of window and variability, but as we've now known, that many of these products are actually not meeting this. And this is a study on products from Ontario, and actually 40% of them were outside of that 15% variability window for THC. And what we're going to talk about today is some of the impacts of the Cannabis Act. And this Cannabis Act that was passed in 2018 aimed to regulate and legalize cannabis in Canada, to protect public health, to keep cannabis out of the hands of young people, and to eliminate the illicit market by providing this controlled access to cannabis products. We've now seen, 5 years later, there's cannabis stores pretty much in every single community. And while I will not be talking today about some of the impacts on the medical field and on the research side, there really has been some unintended consequences of this legalization and movement, and that's really going to be what we talk about today. And just to set the stage, this is some work that one of our project managers at C4T did along with Pediatric Emergency Research Canada, and I think it really sets up the talk that we're going to hear from our speaker today. And when we asked 84 of the emergency medicine physicians that are working in pediatric emergency medicine departments, we asked a lot of questions about kids coming in with cannabis poisonings, and 70% of them said that they are, in fact, seeing more presentations to the emergency department since the Cannabis Act in October of 2018. And so you can read about that paper, and we'll provide a link to that paper. It is open access in the YouTube chat for those of you who are watching us. And it's my great pleasure to introduce our speaker for today. Dr. Yaron Finkelstein is a professor of pediatrics, pharmacology, and toxicology at the University of Toronto, and he is a staff physician at the Hospital for Sick Children, where he's been working in the emergency department for many, many years. He is a clinical pharmacologist, and his research program looks at pediatric therapeutics or drugs in acute care settings. And ultimately, his goal is to optimize drug safety, especially for drugs that are highly toxic, and to prevent and help manage pediatric poisonings. And so with that, I'm going to ask that my slides come down and we move over to our speaker for today.
Great. Thank you so much, Lauren. It's a pleasure being here. And I think we have a lot of folks both from Canada and elsewhere. Um, as mentioned, the topic of my talk will be the impacts of legalization in Canada on especially acute poisoning in children, as well as on, I'll touch about mental health in youth. Just trying to run the slides. So I have no conflicts for this talk that are relevant. And what I will be talking about is really, these are kind of the main objectives. We're going to review the changes in recreational cannabis before and after legislation, the medical cannabis, the Cannabis Act in Canada. We will talk about acute poisoning, mental health, and we'll also look how differences in legalization in different provinces actually affected those impacts. What I will not talk about is what Lauren mentioned at the beginning, which is a uh, big part of the portfolio of the C4T, which is medical cannabis. This is a position paper that we wrote together, published a year ago by the Canadian Pediatric Society, looking at medical cannabis, giving some guidance and information for prescribers. This is, as mentioned, not what I'm going to touch about. I'm going to talk about other more unwarranted impacts. So in 2018, Canada became the second country in the world to legalize cannabis after Uruguay. And from many perspective, it was the most and probably the biggest natural experiment in medications or drugs ever done in Canada. And with that in mind, when the legislature approved that, I think this is what they saw in their mind: people enjoying cannabis and taking it for pleasure. But this is how I see cannabis many times. This is the resuscitation room at the hospital for sick children. This is actually a mock code of a case that involved cannabis or other intoxication. So we actually, in the clinical practice, see things are very different than what the legislature wanted us to see. And for those who are less familiar or maybe outside Canada, just a bit of context. So, as mentioned, in October 2018, uh, non medical use of cannabis was approved in Canada, the Cannabis Act. Obviously, was for adults, which is an important point. I'll get to that in a second when I'll talk about children. And this was for use for adults, not for children. But before the actual legalization, there's a few things that has happened. This was a discourse discussion over a couple of years, and with that, and as we got very close to the formal legalization, which was actually postponed several times, there were more and more positive discussions, pro-cannabis messaging, media, YouTube, Twitter, etc., and it has become much more acceptable socially, even before legalization. And that is an important thing to appreciate. This is very true because we're now talking about many other countries who are considering legalization or have legalized or in the process of legalization. So it's important to understand that even before anything formal happens, there are movements, there are social elements that happen even before the formal legalization. The other point that's important to understand in Canada, and this also affected how things have evolved, is the issue of a two-tier legalization. So in 2018, the federal government allowed the use of the flower form, resin, the natural form of cannabis, oils, flowers, um, and so this was kind of the original national legalization. About a year after, they allowed the provinces, each province, to decide for themselves whether they also want to have a commercial market. And a commercial market is very different. This means infusion of cannabis um, um, elements, especially THC, obviously in this case, into different products such as food, beverages, chocolate, candies, etc. Most of the provinces opted to do that. Quebec was kind of an outlier because they were at the time very concerned about what might happen to children or is now exposed to chocolate either by or brownies or beverage, either as an accident or intentionally. And at the time, they did not allow that commercial market. It has changed. I'll touch that later. But at the time, there was a big dichotomy between Quebec and most of the other provinces. So immediately, shortly after the legalization and commercialization, there was a huge boom in retail. So almost 70,000% increase in retail stores just in Ontario. I can tell you that at the time my daughters were younger and all their ice cream stores one day disappeared and became cannabis stores. So they were not very happy with that. And as you can see, even from the sales, they just boosted up. And cannabis, I believe now, is the seventh largest industry in Canada. So we're talking about impacts that have economical impacts on taxes, on jobs, etc. It's not just the social or the medical impact. So definitely a huge market in Canada. Now, I want to stop for 1 second and talk a little bit about some of the basic principles of cannabis use. Because we sometimes confuse and talk about cannabis as a single entity, but obviously it's not. It's the plant itself has more than 500 or 600 bioactive compounds. Some of them have contradicting effects. Obviously, the two main studied one are THC, that is used mostly for its euphoric effects, for pleasure, or what we call the recreational use, and CBD, which has anti-inflammatory and antioxidant effect and is used many times in the medical industry, for example, in refractory epilepsy syndromes. But as I mentioned, there's many other compounds that most of them are not even well studied. Now, when we use cannabis, the two main ways to consume them either by inhalation, the weed through a joint, or by ingesting, as I mentioned, the commercial market, cookies, chocolates, etc. The pharmacology of each of those is very different and it's very relevant to what happens in young children, which I'll touch in a minute. But just to put it in context, so when somebody inhales or smokes weed, the onset is, as we know, very fast. And the peak effect is in a few minutes and it lasts for several hours. And typically, joints have 2 to 3 to 4 milligram of THC. When you ingest a cookie with cannabis, first of all, the amount of THC you can put inside is almost can be obviously larger. You can just make it way more or way less concentrated. The onset of action is much slower, and it's again very relevant to young children. It can take half an hour or an hour until you start see any effects. The reason is it doesn't get absorbed from the lungs like the inhaled cannabis, but it needs to be digested. It needs to go into the stomach, into the small bowel, and then get digested and absorbed. And that takes time, like it takes time with any other food. So when somebody consumes that in a form of a cookie or chocolate, the effects will not start as fast. And in young children who are unaware, they can just continue to consume them until they start to feel any effect. And by that time, the amount may be very large. These are the symptoms, kind of a rule of thumb. It's not always the case. Some patients or kids obviously respond differently, but usually 1 to 2 milligram per kilogram of THC. There's some more modest symptoms. You go to about 5 or more. Usually there's what we call ataxia, confusion. Many of those kids need admission, and above 10 milligram per kilo, most of those kids will require admission to the intensive care unit with a lot of medical interventions, mechanical ventilation, etc. I can tell you that we've seen such effect in even much lower doses when we had confirmed cases, but this is just kind of a general rule. Um, Now, the other very interesting difference between adults and children is that when young children ingest or exposed to cannabis, they many times present with much more severe symptoms than we would see in adults. And beyond the confusion, we many times see seizures, respiratory depression. Some of them stop breathing or develop what we call apnea. And we've seen kids coming in with full coma, not responsive to any stimuli, and obviously require a lot of intensive care modalities. And I'll get to that in a second. So I'm going to start with maybe presenting a case that we managed 7 or 8 years ago. And we're not breaking any privacy here because this case was published in the medical literature. I did change a little bit of the details now, but the concept is, you'll see, is very, very clear. We saw this child actually about 2 years before the formal legalization. As I mentioned, it does, at that time, we've started to see more and more cases. Even it was not formally legalized, the whole environment was very much supportive of cannabis use. So it was on the market way more than before. So this was a 2-year-old kid who was found by his family after a nap, and they couldn't he had a nap, was difficult to arouse, was very sleepy. They called the ambulance and brought him to another hospital, a community hospital close to their home, with some unusual behavior. He was giggling, talking the nonsense, and was not really interacting with the team. What was interesting in the history that the grandmother was an opioid dependent, and she was actually, she took him to the pharmacy at the same day to take her methadone. And so when the patient was seen in the emergency department, they really were thinking about methadone toxicity. Methadone is a very strong opioid. And that was kind of the main concern. The child initially was fine in the emergency department, and as time passed, he became more and more drowsy and less reactive. They did some basic blood work and ECG, and things look good. So as I mentioned, they thought that this was an opioid toxicity, and they gave him Narcan, naloxone, which is the antidote, with some partial response, and they repeated the same dose again and again, and the child didn't improve, and then they decided to transfer him to our emergency department at Sick Kids. Now, when he was brought in, at the time of arrival, there was a question whether they can actually breathe effectively and what we call protect the airways. And we were very concerned about that. So we intubated the kid, put him on mechanical ventilation, and sent him to the intensive care unit. And all the way up, because we didn't really know exactly what's happening, we did a CT scan of the head and later on a lumbar puncture to rule out encephalitis or meningitis. Now, when we had some more time to dig more into history and the family was more willing to disclose, they mentioned that he was taken in a backseat of a car and they think that there was some cookie that might have had cannabis in it. And we sent his urine to toxicology, and indeed it came back positive to cannabis, and this was the eventual diagnosis of this patient. Now, this case was one of the first cases reporting this kind of event, but it does highlight several elements that are very important to us when we talk about cannabis poisoning and understanding the impacts of children. So, first of all, many times there's no clear history of the exposure. Now, today with the legalization, I find most people are much more open to talk about that. But still, not everybody is disclosing that their young child was exposed to cannabis because they're concerned about um, social implications, apprehension of the child by social services, if there is a feeling that the house is not providing safety, impact on other siblings. So this is something that we need to remember. Another element that's important is that unlike some of the other toxicities, cannabis doesn't have a very specific picture. The symptoms that I mentioned can happen in many, many other drugs and many, many other exposures. There's nothing that's very specific, what we call a toxidrome, that really is manifested specifically for cannabis. Another point that I think is very evident in this case is that, without that identification or early diagnosis, this child underwent a lot of other unnecessary tests. If in hindsight, because we didn't know why he's unconscious, etc., he had to go a CT head to make sure there's no trauma, that he didn't fall and hit the head. And this was done under full anesthesia. He underwent lumbar puncture, which is quite an uncomfortable and painful procedure. So many of those kids, if we don't get the early diagnosis or if it's not disclosed, many of them undergo many other procedures that are part of the ruling out of other diagnoses. And then the last thing that I wanted to mention, again, I mentioned before the child protective services elements and the fact that many of them are um, looked after or followed up by different social services. We also don't know what are the long-term impacts of the actual intoxication. So this child was at least semi-unconscious for some time, was intubated. Those things at the age of 2 or 3 years can have implications later in life and other effects that are very hard for us to measure at this point in time. So with that in mind, after having that case, and we actually started to see more and more cases, a group of my fellows, led by Dr. Cohen at the time, decided to look what we actually see at SICK, the Hospital for Sick Children, and how the legalization impacts. So we looked at the period before legalization versus period after legalization and compared pediatric cannabis poisonings. And this is one of the slides or the figures from the study. And what we can see here, the blue bars represent the pre-legalization and the orange one, the post-legalization period. And as you can see, In terms of age, about tripling of the kids who are younger than 10 years, and way more unintentional exposures, which kind of go together with young children, and tripling of the need for intensive care admission and measures. And so what we were seeing is, if before that we saw more teenagers who were smoking or using weed and then feeling unwell and being brought in, we started to see more and more cases like the one I presented of children who are infants, 3, 4, 7 years old, that had no intention to be exposed to cannabis, and were exposed particularly to cannabis commercial edibles. After that initial study at our hospital, we actually enlarged and went very big with the American College of Medical Toxicology and created the world's largest registry of cannabis cases in children, with over 40 sites, Toronto and Calgary in Canada. But as you can see, most of the sites are in the US. We also have sites in United Kingdom, in Israel, and in Thailand. And this is one of the studies that came out from that group, basically looking at risk factors for severe intoxication. And I think you won't be surprised that Eddie Bells was a huge contributor to more severe cases that needed intensive care unit measures, as well as exposure to multiple other drugs. So if somebody did weed plus alcohol plus other drugs, that would also obviously lead to more severe intoxication. This is a quick table of some of the kids we recently saw at the hospital for sick children. Again, I to prevent any breach of patient privacy, and changes the ages, etc. But what I wanted to show here is really that most of those severe cases in the intensive care unit were really through because of edibles that were consumed by adults. And you can see in blue the doses per kilogram that are some really astronomical, 60, 70 milligram per kilo. As if you remember, I said that around 10, and most will need intensive care admission. So these are very severe cases. Lots of them developed cardiac issues, changes in temperature. Some of them had seizures. So quite severe cases, and that many required intubation and mechanical ventilation until the drug goes away. And the issue with cannabis is, for now, we don't have an antidote, unlike opioids or other drugs, and we have no antidote. This is a case that was published about 2 years ago in US, a mom that was having at home lots of gummies. I think she was having a party or something, and her 4-year-old just went into them, and obviously being unaware of the cannabis content. And as I mentioned, because it takes so much time for symptoms to even start, he ate a huge amount and died. And the mom was charged in I think manslaughter. So those exposures can actually be fatal. And obviously, even in the case that I presented from the ICU, I think that if we hadn't intervened in some of them, they might have been fatal too. So, especially for those who are not from Canada, I just wanted to explain a little bit about what was actually legalized. So this is a package of legal cannabis. As you can see, it's plain, it's relatively child resistant, it has a zipper, it has some stamps, it's boring, it's black, and this is all done in purpose, so young children will not be attracted or visually attracted to try them. The maximum dose is in Canada is I'll get to that in a second, but it's 10 milligram of THC per package. In other jurisdictions, it's different, and many states in the U.S. allow up to 100 milligram of THC in a single package. So from that perspective, Canada is a little bit more restrictive. However, this is what we found in the backpacks or the packages that were brought to us from some of those children that I presented before from the that we got into the intensive care unit. So I want to explain. These are illegal cannabis products. These are did not go through any good practice manufacturing. They're done in basements, and they're deliberately attractive and very confusing. So they really resemble many regular candy packages. And to be honest, if I didn't pay close attention, I think almost any of us would be fooled because they really look like regular candies that we have. It's just that the strawberry, for example, on the right side is smoking weed, and then at the bottom it says 500 milligram or 600 milligrams. So again, if you think about a child that's weigh 20 kilos or something, we're talking about huge doses, mega doses, and a child who's opening something like that is unlikely to stop after one candy is going to finish the whole package. So this is again what we are uh, facing in real life. And this is not what was approved or legalized in Canada, but it's just the illegal market that is still out there, um, and creating those packages and very concentrated stuff. And to be honest, the fact that it says 500 doesn't mean that that's what's there. Who knows what's really in the package? It can be more, it can be less, it can be laced with some other chemicals. This doesn't go through any processing. And this is stuff you can easily buy online. So the Oreo, Estonio, and the Starburst gummies are now, they say medicated, but it can have, you have Nutella here. So a lot of stuff that is really resembling regular brand candies and chocolates, etc., and cookies are being manipulated to contain cannabis, and obviously not in a legal way, but it's still out there and it's much more accessible than in the past. I wanted to mention Quebec. If you remember, I think one of the first slides, I mentioned that at the time in 2020, Quebec decided that they will not go through with the other provinces and they will not allow a commercial market. And again, this was because they were very concerned about effects on children. The children will be poisoned. So at the time, they didn't allow that at all. With time, they had some pressures to kind of become more liberal, like all the other provinces, and so they came up with a different plan. They said, okay, so we will allow edibles. However, we don't want it in chocolates and Nutella, etc. So what they did allow is infusion of cannabis, of THC, into vegetables. And so this is an example of, you can see some figs, cauliflower, and so if somebody lives in Quebec and they want to have edibles that are more concentrated, or they don't want to smoke weed and they want to ingest that, and these are kind of the main options there, and really through edibles. And I think this was quite smart if you're considering young children, because it's very unlikely that a 3-year-old will suddenly binge on cauliflower. I think he'll still tilt towards the chocolate. So I'm mentioning that because, as I'll show you in a few minutes, it really had some important impacts on poisoning in Quebec compared to other provinces in terms of pediatric poisonings. So this is one of the more recent studies. We started a thematic line of research, really looking at the impacts on young children. So these are um, monthly rate of emergency department visits of children who are younger than 10 years for cannabis and poisoning across the entire province of Ontario. So Ontario is about 14 million people. We have about 200 emergency departments at different sizes across the province. So we gather data from all of them through one of our administrative database called ISIS. But the point is, I want to show and focus on really the three periods that you can see here. So the period on the left really talks about the pre-cannabis era, where you can see that except for some outliers, it's really pretty flat, very few cases. Towards the first legalization, we kind of start to see, as I mentioned, in 2017, early 2018, we start to see more cases. And post-legalization, there's a jump, but the biggest jump that we can see is really around the legalization of commercial cannabis. And you can see a huge jump accompanied by the number of stores, which are the bars on the right. You can see the number of stores and monthly sales in millions of dollars. So accompanied by bigger sales, way more intoxications in young children that lead to emergency department visits. This is another study led by Daniel Myren, who is a family physician and a researcher out in Ottawa. And we kind of did the same thing, but now we looked at hospitalizations, so more severe cases in young children up to 10 years of age that led to actual hospitalization, either on the ward or in the intensive care unit. And in this case, we actually divided it by some of the key provinces. So Ontario is in red, Alberta and British Columbia in yellow, and Quebec in blue. And what you can see is at the beginning, kind of the similar pattern, some flat. Then as we go into legalization, there's some more cases in the first period. But then with the legalization of commercial products or introduction of a commercial market, there's a huge separation. Alberta, British Columbia, and Ontario basically soar up with intoxications, while Quebec stays relatively flat. There's obviously a little bit of spillage there too, but relative to the other provinces, they were able to really protect children, young children, with their kind of restricting the edible market to those vegetable infusions. This is a bit of a different look, looking at percentages of hospitalizations of young children due to cannabis compared to all other poisonings. So in the past, for example, in 2015, 2016, you can see that cannabis was maybe 2 or 3%. It was quite negligible as a cause for hospitalization for poisoning in children. But as we go into more recent data after legalization of commercial market, you can see, for example, that in Ontario, they now represent almost 40% of all hospitalizations for poisoning in young children. So it basically became the number one reason for pediatric hospitalization for poisoning in the province, and very similar in the other provinces that allow the commercial market. When we came up with those data, it really hit the media. It was for a few days. I felt like Oprah. I was running between radio and TV stations and really just telling about what we're seeing more and more in the emergency department. Because at the time, many people in the public and even some of the physicians were not aware that cannabis can kill a child. So it really caught some attention. But interestingly, I gave an interview. It was 2 years ago, a few days before the Canadian Halloween on at the end of October, um, and immediately after that talk and after Halloween, a couple was arrested in Winnipeg, in Manitoba, for dishing out deliberately cannabis edibles in packages for kids who came for treat or treating. If I believe 12 kids were affected and some of them were hospitalized. So obviously this couple was arrested, but um, just to think about how those things can evolve where they actually became malicious. So this couple were deliberately giving out to young children, 2, 3, 4 years old, who knocked on the door for trick or treating. They were giving them those candies in an attempt to poison them. Um, a couple years ago, after legalization, the Canadian government decided they need to maybe revamp the law. So they created a review committee headed by the gentleman on the left. He's a lawyer, Mr. Maurice Rosenberg. And I had the privilege of speaking with that committee and trying to protect children and make sure that we don't make things worse in Canada, because most of them on the panel were also not aware of those negative impacts. And luckily, this was heard. We were a couple of physicians on that committee that were pushing for that. Later on, met with the Honorable Yaron, who is the Federal Minister of Mental Health and Addictions, and we were at least able to convince them to keep the maximum THC content in Canadian legal products at 10 milligrams of THC. There was some pressure from the industry to push it much higher towards the US maximum, but at least for now, I'm happy that things have stayed at least where they are and didn't get worse. And we obviously continue to monitor the situation. I'm going to switch gear a little bit and now talk about other impacts of cannabis. And I'm going to leave the young children group, and I want to talk a little bit more about youth, about adolescent and young adults. And this is another area that we're studying and looking into in terms of different impacts of recreational cannabis. So I think just to put it in context for those who are not aware, so this is a high school. This slide shows outcome from a high school, a survey that is sent out, I believe, every 2 years, with thousands of people responding to it. And it looks at different habits of behavior, and this is really relating to cannabis. And as you can see in the high school group, 16 to 19 years old, 20%, so basically 1 in 5 Canadians who are in high school report using cannabis daily or almost daily. So again, it's very important. This is not random use over the weekend or at a party. We're talking about kids who feel that they need to use it daily or almost daily for different reasons, dealing with anxiety, fears, other reasons. But again, we're talking about 1 in 5 reporting to use it daily. Um, This is a study that was published already several years ago. It's actually from a group in Scandinavia. And what they were looking at was they wanted to see what are the impacts of different drugs, not just cannabis. You can see the full list on the right side of this figure. Different drugs that we know that can cause somebody to present with acute psychosis. So these were patients who presented at all ages, who presented with the first episode of acute psychosis or paranoia to an emergency department after using different substances. And after this happened, they followed them up to 20 years, each one of those patients, and they were looking what was the risk of developing full blown diagnosis of schizophrenia. Schizophrenia is a chronic mental health condition that's usually a lifelong, requires many times treatment, admissions. So this is way beyond that initial episode. And what this graph shows, if you look especially at the upper graph, which represents cannabis, is that compared to all other um, substance-induced psychosis, cannabis was really the number one. In terms of progression to schizophrenia, over 20 years, about 40% developed or were diagnosed with schizophrenia compared to cocaine, opioids, etc., where the rates were significantly lower. So we decided to kind of replicate this study and make look at different stratifications of sex and age, etc. But I want to share with you a slide that to me is really mind blowing, and it completely changed the way I deal and speak with parents now that I deal with this. So, um, what you see here is what we call a hot map, and this is the risk in percentages of transitioning to schizophrenia after an acute episode of cannabis or any other substance induced psychosis. So, for a second, look at the lower left side bell, and this will be the lower risk. So you can see that females who are 25 to 65-year-olds who are in the general population, not using any substance, the risk of them to converting into schizophrenia is very low. It's about 0.1% or 1 in 1,000. And we looked at only 3 years, not 20 years. We looked at that risk over 20 years. On the other extreme, the right upper corner, we see males who are in high school, so 14 to 18 years old, who came to the emergency department with the first episode of acute psychosis um, after exposure to cannabis. And in this group, more than 41% were diagnosed with schizophrenia within 3 years. So this this figure is really to me mind blowing. That means that if you see a patient like that in the emergency department who is male, is in high school and comes in with acute psychosis the first time, no previous history of any mental health condition, they still have almost a flip of a coin to develop or be diagnosed with full schizophrenia within 3 years. And this dramatically changed the way that I talk with parents and patients when I see them now. Mainly, what I tell them is to absolutely try and avoid such an exposure again if they already develop an episode of psychosis, because the risk is probably much higher than anyone else in the general population, and we can't really prevent that. I think with that, I'm gonna stop and just maybe summarize a couple of the take-home messages. Again, we talked about how legalization increased the incidence and severity of unintentional poisoning, especially in young children. We talked about how severe they can become. They can become fatal in some extreme cases, but definitely many of them require admission to hospital and many times intensive care measures. And we talked about the illegal cannabis products and how they have changed and the landscape of those poisoning, especially if they're packaged in very appealing and highly concentrated packages. And lastly, we mentioned the impacts and potential impacts on mental health, especially in the developing brain of teenagers and young children, which again, the Cannabis Act was never geared towards them. It was only for adults. So I'm going to thank you, everyone, and happy to take any questions.
Thank you so much. That was great. And there's been quite a bit of chat in the YouTube comments. And one of the first questions that came in was one I think about it as well, and it's asking about sort of family willingness to bring kids into the emergency department, and if there's been any research to identify if there's been an increase of presentations because people are more likely to report it, or because there's some more incidents actually happening.
Yeah. So we're confident that there's more incidents happening. I've heard that question many, many times in the past, and I can tell you that if a child has seizures or come in coma or needs intubation or needs admission, it is very hard to not come to the emergency department. I mean, you cannot deal with that at home. So we're not talking here about kids who are a little bit more happy or confused. We're talking about kids who actually require more extreme measures of management. As I mentioned, many of them require admission to hospitals. So in the past, when we had way less edibles on the market, we've seen less. This is not unique to cannabis. Young child, whenever they see something that is attractive to them, we see that in laundry pods, we see that in anything that looks flashy and nice, and definitely if it looks tasty and it's infused into chocolates. And as I mentioned, they're much more prone to be severely intoxicated because they don't know that and they can eat the whole package. So we're confident that this is a real case. And this, by the way, has been seen in many other jurisdictions, especially in Colorado and other places that have legalized cannabis early.
And my next question, I think about, I had to bring my kid to the emergency department here locally. And here in Winnipeg, there's signs in our emergency department about how to store cannabis and don't, storing cannabis safely, but nothing around disclosing, or it sort of almost might make parents less likely to disclose that there may be cannabis in the home and that this may be a cannabis ingestion. So I wonder if you've had any thoughts around, how do we do better? How do we actually get parents to disclose when they present to emergency that there could be potentially a cannabis ingestion?
So we've worked with Health Canada on that, and there's a lot of media and brochures and education, both to the public and also to physicians about that, really suggesting to disclose that. But I can tell you that it is a bit complicated. I don't want to be naive because once you disclose that, there may be implications. And we are obliged, physicians are obliged, especially if a child ends up on a ventilator in the intensive care unit. And we're obliged to report that to the social services to protect this child and maybe other siblings in the house. So it may start some investigation into the safety of the environment, because if it happened once, maybe it can happen again. I can tell you that many people even young people who don't have kids in the house, they say, listen, this is legal. It's a parenting issue, just like you hide your bleach and your rat poison, and then take care of your child and make sure they're not exposed. So there's different viewpoints to this, but I can just say that once this has happened, then it's preferable to let us know, because most cases will be diagnosed at the end. And as I mentioned, delays can lead to many other unnecessary tests, radiation, pain, etc., etc.
Yeah, that paper actually that Zena published says exactly that, is that when the cannabis exposure is unknown, they're actually likely to get way more investigations. They're going to stay in
Absolutely.
hospital longer. There's actually a lot that goes into figuring out what's happening.
Of course, yeah, because differential diagnosis of seizure is very large. It can be other intoxications, it can be epilepsy, it can be trauma. The kid fell on the head. So if we don't know what the information, that these things get
And
much more investigated.
there's a question here about the last data that you're presenting around schizophrenia, and it says, can the relationship between cannabis use and schizophrenia also be in the opposite direction? For example, individuals experiencing psychotic symptoms are more likely to use cannabis.
Yeah, so if I wasn't clear, I want to clarify. Those were all first episodes of psychosis. So those were patients that we went back in time, we looked at their medical charts, and we confirmed that they did not have schizophrenia or any psychosis events before. It is definitely that somebody who has schizophrenia, they may be more prone to take different medications and alcohol, etc., and that by itself can induce more episodes. But for those that we studied, those were all, and also the Scandinavian group, those were all first episodes, and they did not have any schizophrenia that we know of before.
And maybe just a last question, and then we'll sign off for today. There's a few more comments on YouTube that you can check out. Is, in terms of regulations, so the way forward, how do we, there's lots of lobbying from cannabis companies and industries to more, with the goal of the Cannabis Act being to, curb the illicit market, and obviously many of these products coming from the illicit market. Are there any plans to come up with sort of a public health strategy to maybe address some of these more less legally accessible products?
Yeah, so this relates to kind of law enforcement, and so I wouldn't be the expert on that. I can tell you that, and I wanted to mention that this is not an anti-cannabis talk at all. And I mentioned, we work together a lot on medical cannabis use, etc. The aim is really to protect young children who are incapable of protecting themselves. And just like you wouldn't, as I mentioned, put rat poison in chocolate, for them, this is intoxicating. Their symptoms are much more severe than in adults. And the whole advocacy work was really geared towards protecting young children. I think the government is doing a lot of stuff, and as I mentioned, both on education and other fronts. As for law enforcement, I think this is a bit outside of the scope of my expertise.
And I guess one tiny little question, because I see it was entered in twice. So someone really wants to know, are hospitals and emergency rooms now collecting data on if the products that causing the child in the ER are legal or illegal? And if not, why are we not collecting this data?
Yeah, so we're trying to do that, and the Canadian Pediatric Society, as you know, has like a program to do that, and it's on an individual. When you're exposed to anything that causes toxicity, you're supposed to get the information. Again, we just need to be cognizant about what we're told and what do the parents disclose, which may or may not be accurate. And we're not police, so we can document whatever we're told, and we may be told something that is not exactly accurate. And again, making a brownie at home with weed is not illegal. It's just unregulated. So we may not know exactly the amount that is in every brownie or something like that. So that's something to be aware of.
Great. Well, thank you so much. This was a fascinating talk, and I'm sure that there's lots of questions that they may have. So hopefully you don't mind if we share your email, or anyone can reach out to us if they have questions, but what was presented today, and we'll make sure to get an answer to you. So thank you so much.
Okay.
And we'll
Thank you
see
so
you
much.
all.
Thank you. It's been a pleasure. Thank you.
Bye.